But I want to bring someone forward I'm so proud of because she's a Congresswoman today. She's going to be a Congresswoman tomorrow. Our United States Congresswoman, Mary Jo Kilroy.
Around this room and listening to how you reacted to my wonderful colleagues up here, what they had to say, that you are in favor of health care reform now. Well, you know what? So am I. And I am looking forward, and it will be my great honor and privilege to go back this fall and vote for a health care reform bill that will provide affordable and accessible coverage for all Americans and those 72,000 in Ohio 15 who are without coverage now, and for all of you and for all of your families. It'll be my pleasure to go back to Congress and work hard for a bill that improves quality of care, that provides us as Americans with our choice of doctors and our choice of plans, that helps us to live a healthier life and includes a robust public option. But you know, really starting back in February, I've been holding meetings about health care, meeting with large groups and small groups, holding town halls, talking to groups of farmers in Plain City and small business people at the chamber, talking to nurses, talking to union members, talking to physician groups, looking at people like churches, all around the community. And during the course of this discussion, some of the people have some questions about what's going on. And there's some people out there that might be listening to this who have questions about what's going on. People who've heard the noise machine, people who've heard the scare rhetoric, people who are maybe just genuinely undecided about why we need to do this. And one of the questions that I hear frequently in the course of these meetings and these discussions is, what's the hurry? So, I want to pose an important question to those people who might be undecided or who might be saying to themselves, what's the hurry? I want to ask them, what are the consequences of inaction on a comprehensive health care reform bill? First of all, what happens to the cost of health insurance for those of you who might have insurance? For those employers who might be providing insurance? You know the answer. More double-digit inflation in the cost of health care. More situations like General Motors fines when they pay more for their health insurance than for the steel they put in the cars they make. How many more employers, if we don't act, in this employer-based system will drop their coverage if health care continues to escalate? You know the answer. 5% fewer employers provide health insurance than just a couple of years ago. And every week in this country, 14,000 Americans lose their coverage. Many more will do so if we fail to act. And how many people will file for bankruptcy or lose their home because of crippling medical debt? Right here in Central Ohio, we've had record foreclosures, record bankruptcies, over half caused by medical debt. Like Linda and her husband Jerry, a hardworking couple here in the Grove City area. Linda worked 30 years as a waitress, and as a result of her hard work, she's developed carpal tunnel syndrome and other medical They did everything they were supposed to do. They paid their insurance premiums while they were working. But Linda can't work now, and that concrete plant has laid Jerry off. Now they have no health insurance, and no health insurance provider will write for them. So they're paying for their health care bills on their credit cards. And now their credit card companies want to be paid, and they are in danger of losing their modest home and its lovely vegetable garden. We've had many thousands here in Central Ohio lose their homes already. We need to put an end to them. And we need to take a look at this issue of how many more people will be discriminated against in this health care system because they have a pre-existing condition. Well, if you've lived a little bit of time, you're going to get a pre-existing condition the way they define it in their regulations. You know, the Ohio Department of Insurance will show you 3 pages, single space, 3 columns on a page of pre-existing conditions that have been used in Ohio to deny people coverage. Conditions like asthma, or diabetes, or multiple sclerosis, or, and this is true, even acne has been used to deny coverage. And because of that discrimination, how many will not get the medicines they need to maintain their health or to stop the progress of their chronic disease? And how many people will exceed their lifetime caps or their annual caps because of a serious health condition and not being able to pay for needed treatment, life-saving treatment? We should not have to sell these wristbands so that teenage children can get the coverage